Hello and welcome to the Sisters for Fitness Wellness Show. I'm Stephanie Gaines-Bryant. Our guest today is Nicole Ruffin, and she's a massage therapist. The name of her business is Care Essence.
Yes.
Welcome.
Stephanie, thank you so much for having me. I'm so excited to be here.
Now, I have to fess up, I am one of your clients.
Yes.
And you've also, because people think of massage as something you just do for a pleasurable thing. And you're a massage therapist, which
Yes.
means a lot of people do massage as part of their wellness program, as part of their self-care.
Yes. So what happens is we tend to think of massage therapy as something that we need to do when something goes wrong. But massage therapy, when something goes wrong in the body, if we feel aches and pains, if we fall or hurt ourselves or something, or if we've had some illness, if you will. But what massage therapy can do is it can help prevent aches and pains and injuries and things like that. It can help reduce stress, increase the circulatory system. It can reduce blood pressure and all of these things or whatever. And overall, just well-being. My philosophy is we want people to feel better leaving than they did when they came in.
Now, Nicole, the reason I go to you is I do a lot of physical activity. I teach yoga, and I like to do a little run walk every day.
Right.
And it just, I get a lot of aches and pains from overuse.
Yes.
And how does massage help with that, that overuse of the muscles?
So what happens is, and I applaud you for your daily maintenance and your exercise and things like that. So what happens is we, when we become sedentary sometimes, or if either sedentary or over abusing our bodies with our workouts. You know how some people go into the gym and just overdo it or whatever. It gives you an opportunity to check in. So there's a lot of times when I am working on someone and I start working in an area, because basically the work that I do really doesn't come from my hands, but the information is given to me through my hands. And what'll happen is when I'm working on them, they'll say, oh, I didn't know this was going on. Because when I'm working on a particular muscle, I'm working above and below the areas, so I'll identify areas of stress in their bodies or aches and pains that they didn't recognize. And so the reason why it's beneficial is because now they can pay attention to it when they're home. So I'm bringing that awareness to them. So typically, if there's pain in the arm or whatever, I'm working the wrist, the elbow, and the top of the shoulder, as well as where they're identifying the pain. And then I can give them training, verbal training, about how they can change things in their daily routine to prevent that from happening.
How does stress, we think of stress as a mental thing. How does stress manifest in the body?
Because we're not good listeners. So there are routines that we should have, like walking and exercising, and not just laying or being sedentary and just laying around and things like that. Our bodies will give us indicators that we need to move. We need to listen to what our body is telling us. If we have signs or symptoms like headache, blurred vision, aches and pains that have just come on suddenly and things like that, it's probably our bodies on the inside telling us that there's something going on and we need to take time to listen. For example, scheduling my schedule. I have a conversation with my assistant that, I need to take a break, and sometimes what will happen is a client will call in and I'll use my break to take my client. That's an indicator, if you do that too many times, that your body will say, no, you need to slow down, you need to pause, you need to take a break, you need to go for a walk, you need to take some time off, you need to take a vacation,
So we have to learn to listen to our body.
Listen to our bodies.
A lot of us have gone through a lot with COVID.
Yes.
It changed our lifestyle. A lot of us are more sedentary because of COVID than we were before.
Yes.
How can massage therapy help with that?
So what you want to do is sort of add something into your routine. There are things that you can do at home, like self-massage. People are buying those massagers. But the problem is with a table massage, when you come into the office or whatever, I'm getting points or body parts that you're not able to reach. And so when you have stagnation in your body, or if you have acheness and pains and things like that, compression and strokes that we use in our technique or whatever will help send oxygen to those areas that are stuck, that are painful, and it'll help break up the adhesion that's created in the body so that the oxygen, when the oxygen comes, then the blood will flow and circulate, and all of that movement will help release any of the pain that you're feeling. Yeah, you feel a lot better.
And massage not only helps with blood flow, it helps with the flow of lymphatic fluid. Can you talk to us about what exactly is lymphatic fluid, and why is it important to make sure that it's flowing through our bodies properly?
I'm so glad you asked. So the lymphatic system is sort of our garbage system, if you will. We are exposed to so many things in our environment: the stress, the pollution, the foods that we take in, the sedentary lifestyle. I can't emphasize that enough. Sometimes we get ill and there's like knots and adhesions and adhesions in our body system and things like that. Or we just feel sluggish, like an accumulation of mucus in our body, or we call it stagnation. And so you notice that something is weird about how you feel in your body, and the lymphatic system is what takes that out of your body system. Our heart has a pump, but our lymphatic system does not. So our lymphatic system is directly underneath our skin, and what happens is it needs movement. So whether it's manual movement like exercise and yoga, or a massage therapist that will help focus on the areas, particularly your neck, under your armpits, and your groin area, that's where we have what I call lymphatic wells. You will not find that in a medical dictionary, but what happens is once we unblock the lymph nodes, we send the fluid into those areas to help get it out of the body. You can sweat it out. You might have an accumulation of mucus that drains out of your system, definitely through your urine and through your fecal matter.
Now, people who have had breast cancer treatments
Yeah.
are especially prone to having lymph that's not flowing properly,
Right.
because of they may have had a lymph node or some lymph nodes removed.
Exactly.
And so whatever the removal causes the lymph to get backed up.
So when you think about people who've had surgeries, particularly those who have had lymph nodes removed, or people who've had surgery in general, because it's when you cut into the skin, you automatically cut into the lymphatic system. And so if the lymph nodes, and the lymph nodes don't move, or they don't work as fast as other body systems do. You know, like think about when you eat food, how soon afterwards you go to the bathroom, right? Well, the lymphatic system needs to take time to process things. And so we're giving it more information that it can handle, and it needs time to process all of that. It needs time to process scarring and scar tissue. The fluid will back up when there's scar tissue there because it's supposed to flow through the lymph nodes. If the lymph nodes are damaged, the lymph nodes need to be restored first, and then the fluid can come out. And so what happens is there's an accumulation of fluid, typically wherever the surgical scars are, and the belly is one of them that's really tremendous, because a lot of times you'll see an accumulation of fluid in the stomach, and a lot of people assume that it's all fat cells, and sometimes it's not. Sometimes it can be from plastic surgeries like liposuction and tummy tucks. Other times it can be surgical, like the hysterectomies or the C-sections. And if there's scar tissue that has never been addressed or treated, then that scar tissue is just going to grow and grow and grow, and the fluid is just going to be backed up. So when you see all of this swelling, you think it's fat, and it's not. So that scar tissue has to be restored. Then a therapist would have to help with manual lymphatic drainage to break up the scar tissue so that that fluid can flow out.
How do you test to see whether it's that? Do you do some sort of intake or whatever with your clients to kind of figure out what's going on?
That's a good question. So a lot of times with talking about the lymphatic system, they don't know. And so we'll ask, we always do a health intake form when they come into a session, but we also do consultations before they come in and answer any questions that they might have. And so usually when you ask clients about anything that's going on in their body, any surgeries and things like that, they usually forget until they get on the table. I always laugh at that. But so once I find out, you know, where they need treatment, because they'll come in for one thing, and then as I'm asking more and more questions, or I do exploratory work on their body and things, I'll find out that there's something else going on. So if there is a concern about belly fat or cellulite or something like that, I will ask questions, and once I find out if they've had surgeries or discover the scars while I'm exploring them, then I'll kind of move them into another direction and say, let's address this first, because if we can open up the lymph nodes, then all of this other fluid will be released, which I think is always funny, because they're really amazed at how after one session they'll see changes. It's not always a drastic change, but like the amount of times that they may urinate is always fascinating to them, or maybe like their first bowel movement after their first session or something or whatever, and it's like, oh my God, I can't believe it, because we're opening up the lymph nodes and getting all of that stuff that's been stagnant or that they've been holding on to for a very long time.
So do you recommend, is this something that you come up with a program and you get this done once a month? Is this something that you get done just once or twice? What do you recommend is the best way to keep that, to keep it flowing on a regular basis?
I think it depends on what their issues or concerns are. Typically, like I said, with the women who have had, well, men and women who have had plastic surgeries, like the tummy tucks and things like that, we usually plan a session, because they usually have a lot of swelling immediately after their surgery, and they're still draining the lymph from their surgery, and they're draining from their surgical ports and things like that. So with people who are post-surgical, we'll ask them to come in at least 3 to 6 times, and we usually have them come more frequently, like 2 or 3 times within the week. But someone like you and I, who are just looking for a release of lymph nodes that we may feel congested or stagnant in the area of our bodies, once or twice a month is fine. Once a month, especially if you're working out, I consider it a supplement to what you're currently doing.
That's what I do.
Yeah, and so the other thing too is people who look at quick ways to lose weight or whatever, this is not going to be the fast, immediate way. But if you are holding on to lymph, if you are holding on to fluid and waste and toxins and fat cells and things like this, this would definitely be a supplement to the work that you're already doing. Because like I said, the lymphatic system only is activated when you are moving. So I assist with that process, but you'll actually feel lighter after a session. Most people have to go to the restroom, and then you'll have more energy to do more. So like if you've been sedentary for the last 2 years and you haven't worked out in a while or whatever, then I would recommend that you do come and get a lymphatic treatment, and that should be a kickstart for wanting to do more and more work.
So the more elimination, the better.
Yeah.
Meaning the more you urinate, move your bowels,
exactly,
the better.
Yeah. And if you're experiencing constipation, you're definitely a candidate for lymphatic drainage. We do have 2 types. So we have the manual lymphatic drainage, which typically we do for people who are post-surgery because they're in a lot of pain and they're holding on to a lot of fluid and they need to get all of that out of them. And so you wouldn't use a lot of the tools that we have in the treatment because they're still sore, they're still aching, you know, they're still in pain. But we have what's called electrolymphatic system, lymphatic drainage, or lymphatic frequency. And that's when we start using tools. So you have to be certified or trained in this technique. And the tools will help to push the fluid, I'm going in the opposite direction, will help pull the lymph into our lymphatic wells, like the groin area, the umbilicus, the underarms, and in the neck. It's the difference between hand mixing a cake and using a mixer, you know. So with the manual lymphatic drainage, you may need several sessions or whatever. With the lymphatic frequency, you may need maybe 2 or 3 sessions or whatever. And then the other thing too is you have to consider how much fluid you're holding. So if someone who's larger in size or whatever may need a few more sessions or whatever. And they'll start. So what we would do is we take before and after pictures so that they can see the progress, because it's not going to be like when you come in and you get on the scale and you weigh one number. You're not going to see drastic number changes after 1 or 2 sessions. It takes time, and so the photos are a really good indicator of how well they're progressing with the drainage.
A lot of, especially African Americans, suffer from chronic diseases that cause inflammation. Mm-hmm. And how good is massage? For example, I'm a diabetic, so how good is massage for things like inflammation?
Well, what happens with diabetes is you develop circulatory issues, right? And so with the massage, we are helping to move things in a direction to either help them to be released from the body or to help stimulate in that area. So typically, problems with the legs, ankle, and the feet are common for people who are diabetic. So any work that you do to open up the vessels will help them feel better. You know, what was I going to say? There's this issue with oxygen, right? So when you have blockages anywhere in your body and oxygen is not getting to it, there's a term called necrosis that means death. If there's no oxygen getting to that area, then it's going to be painful, it's going to hurt, it's going to become discolored. So these are all indications that there's not enough circulation. But before you get to the point where the doctors are talking about cutting your limbs and things like that or whatever, massage therapy will be good, because you can do compressions, you can do all kinds of techniques and strokes to help send the oxygen back to that area. Now, the interesting thing is, depending on how bad the circulatory issue is, you're going to feel a lot of pain. And so when you start sending oxygen back to that area, you're going to feel tingling, you're going to feel all kinds of pines and needle feelings and things like that. It's going to be uncomfortable, but that's because the oxygen is getting an opportunity to get through. So it's working. It's working.
You know, when you go to a massage therapist, there's so many different types of massages that are offered.
Yes.
How do you know what to choose?
So we always start with the basic Swedish and deep tissue massage. And deep tissue does not mean painful. It just means that we're going into muscles that are deeper than the superficial muscles that you see. For example, gluteus maximus is the outer muscle, but you also have a gluteus minimus and a gluteus medius and minimus or whatever. So what happens is the deep tissue is allowing us to apply more pressure so that we can get to those deeper muscles. People who are athletic.
Yes, what's the difference between that and the sports massage?
The sports massage usually contains a lot more stretching and pulling and tugging and things like that or whatever, because you get chronic contraction, and so it needs to be opened up. A lot of people do not like to stretch when they work out as part of their routine.
They don't. There's a big argument. Do you stretch before? Do you stretch after? Do you stretch at all?
Well, you definitely stretch. You're definitely supposed to stretch. But if you don't stretch, those muscles get really, really contracted, right? And so, you know, people who are like gurus of working out and things, they don't have time to stretch, right? And so the sports massage helps to alleviate any of that tightness, the hamstring tightness, any to help prevent injury, actually. So you are overwhelming your body, and so you come to us to help get some relief. And the other thing too is it's important for the therapist to know that just because the body part that you're telling us is hurting, it's our responsibility to know where the injury might actually be coming from. So sometimes people are talking about chronic, this is a good one. People are talking about chronic back pain, but a lot of times it's because of what's going on in the glutes. And so their glutes are really, really tight, either from overuse or not using it enough. And if your abdominal muscles are weak, you're going to have really, really tight QL muscles. They're called quadratus lumborum. I didn't want to say that out loud, but the QL muscles are tight in the back. And so just working the glutes will help release that, but it's also it's a combination of the two. It's the responsibility of the client to do some work on their abdomens to strengthen their abdomens, because the weaker their abdominal muscles are, the more back pain that they're going to have. So that's where the therapy comes in, the technical work with our hands, but then the information that we provide as well. So we don't just have them get on the table and we work on them and then send them home. We usually send them home with some information like how important it is to drink water, because
How important is that to drink water?
because what happens is when we are doing our work and we're increasing the circulation or whatever, those cells that have the lymph, those cells that have all of this waste that's still stagnant in their bodies, we're moving it along. And so the water helps get all of that stuff out. So I usually recommend anywhere from 64 ounces to half your body weight in ounces. And the reason why I do that is because I have a boatload of people who do not want to drink water. They don't like the way the water tastes.
Oh my gosh. For years and years, I don't want to drink water. I don't like the way it tastes. Now I'm a connoisseur of fine water.
Yes,
now
exactly.
I drink a lot because I feel and see the benefits.
So the
of
interesting
drinking.
thing is, our bodies are, depending on what medical dictionary you look in or whatever, our bodies are 70% water. So people who say they don't like water, it just baffles me.
Mm-hmm.
But most of the time, the injuries that we're carrying in our body is because we're dehydrated. And so when our bodies are telling us that we're dehydrated, no, you don't need to go to get surgery. No, you don't need to go and take medications or whatever. You just need to find out what's going on in your body. And so whether you drink cold water or room temperature water or fancy water, alkaline water, it just helps to quench the thirst of what your body is asking for. So some of that congestion and that adhesion and those chronic buildup of mucus and fat cells and things like that, all of that can be flushed through with water. And so what happens is the massage therapy gets the body going in the right direction. You drink the water to flush it out, you start feeling better.
And what are some of the other follow-ups to do after your massage that you need to do? You said one is drink water.
Yes.
What are the other things you do to kind of maintain
So-
until you can get back to the massage therapist again?
I would encourage people to just do something basic like walking. I think you said you do a run-walk combination.
Yes, I do.
Because it's important to keep the movement going. It helps with circulating the blood through the body, the oxygen that's in the blood through the body, getting your body hydrated with the water. It's just basic movement. It doesn't have to be long, strenuous, or overwhelming or whatever, like maybe 5 minutes, maybe a walk around the block or something like that.
And to keep that lymph moving
Yeah.
in between, how would you do that to make sure?
Moving your arms, moving your legs. There's a brush. I could always show people how to. There's a technique to use when you're doing dry brushing. So
can you show? Do you have a minute?
Sure.
Okay.
So you always want to move towards the heart.
Okay.
And so what you'll do is with your arms, you always want two things. You want to go in a circular motion, clockwise motion, but you're going up the arm. Mm-hmm. You're going towards the umbilicus and up towards the heart. From your legs, you always want to go up towards the groin area, up towards the heart. And then when you're in your face, head, and neck, towards the back of the ears, down the neck, and across the top of the shoulders.
And you don't have to it's just light
It's
brushing?
a very light touch because the lymphatic system is just underneath the skin. So if you're going too deep, you're going to the muscle. So it's just a light brush. And the dry brushing you can do before you take your shower. And there's also Himalayan sea salt. The Himalayan sea salt, we have Himalayan salt rocks. Those, after treatments of the lymphatic drainage or whatever, sometimes you're depleted of the minerals in your body. So we're made up of water, oxygen, and minerals. And so the Himalayan salt rocks help to restore some of the minerals that might be depleted or lost in the body.
And so you do that as you do your rub?
You do that as you do your rub. I tell people to target their scars, their scar tissues, wherever their surgical scars from their post surgeries, and wherever they're experiencing joint pain and aches and things like that. One of the things that I do is I'll put it on my belly during my menstrual cycle and just let it sit there. You use a little bit of oil, not water, because salt and water will dissolve it. So you just use a little bit of oil, apply it to that area, and it'll help with aches and pains.
I want to go back to one thing. We only have a few minutes left, but I want to go back to one thing before we wrap it up. We were talking about the fact that people have been, stressed and leading a different life with the whole COVID thing. How to get back on track with making sure that because massage is not just physical, it's mental as well. How do you get back on track?
I would first start with identifying what your stress factor is, because for everybody it's going to be something different, whether it's financial, relational, spiritual, or anything like that. So start by writing down how you feel. And based on writing down how you feel, it can kind of lead you into a direction of what you think you may need in order to get some release or some help. You might identify that you might need assistance. You might need a massage therapist. You might need a mental health therapist. You may need a physical therapist or an instructor, a yoga instructor, as I was trying to say, to help you get back on track. And so one of the things that I can do, I'm not a talk therapist or whatever, but when I listen to what people tell me about what's going on in their lives, because I do get that information or whatever, I can kind of give them some guidance on what directions they may need to talk to someone, because I'm not going to be the answer. The only thing I can do is help you with your muscles, but your muscles and your lymph. But sometimes they're not even having that conversation, and just to have someone listen to them, I can say, oh, this is where this can take you if you listen to your body and go into this direction. If you need someone to talk to, it might even be as simple as talking to a friend, but you need to have an understanding that there is even something going on. So start by writing it down.
Very good.
Thank you.
And Nicole, Care Essence
Yes.
is in Greenbelt, but we'll give that information at the end of the program,
Okay.
where you're located and how they can get in touch with you and get that lymph flowing.
Yes. Get moving.
Get moving,
Yes.
get the blood flowing, get the muscles flowing,
Yes.
get everything passing through. You gotta get it out. You
Yes.
gotta to let it pass through.
Yes.
And like you said, the muscle, or the heart is a muscle and helps pump that blood to other part of
Yes.
but you gotta get that lymph
You got to get that lymph moving.
Yes.
Yes.
Thank you so much. We've been
you so
talking
much for
to
having me.
Nicole with a H, Ruffin, and she's a massage therapist, and her business is Care Essence in Greenbelt. And as I mentioned, we will give that information at the end of the program. Welcome. You are welcome anytime.
Thank you.
And I will be on your table again sometime real soon.
I look forward to it. Thank you so much for having me. I'm so grateful. I appreciate it.
You've been watching the Sisters for Fitness Wellness Show. I'm Stephanie Gaines-Bryant. Have a great day.